Today on the Ascent Health, we're talking about a topic that affects nearly every woman, breast health. My guest is Sheri Higbee of Advanced Thermal Imaging of Alaska. Sheri shares how breast thermography works, how it differs from mammograms, ultrasounds, and MRIs, and why she believes that women should not only focus on detecting breast cancer, but also on reducing their risk before cancer develops. We discuss dense breast tissue, estrogen dominance, lifestyle factors that influence breast health, and how thermography may provide additional information about physiological changes occurring in breast tissue. As always, this episode is for educational purposes and is not intended as medical advice. Decisions about screening and treatment should be made in consultation with your healthcare team. Let's dive in. Welcome to On the Ascent Health. I am here today with Sheri Higbee, and we're talking about breast thermography, and I'm super excited to talk about it.
Yeah, I'm super excited to be here. What a treat.
So what is breast thermography? Why is it such a big, important thing?
Yeah, I wish that people knew more about it because it's a pretty neat thing, but it is basically using infrared heat to detect physiological changes in the breast ahead of time. So what we're looking for are changes in the breast that could maybe be indicative of cancer developing or lack of health. Thermography gives us the ability to look inside a breast in real time, like what's going on today, to see what is the status of your breast health. What is your risk of getting breast cancer? Even better than like a BRCA gene test would have, because we know that those are women could be predisposed based on their mom getting breast cancer. But when you're looking at a thermal picture, you know exactly what your risk is.
What does a thermal picture look like?
It's basically a heat picture. So it does not do any harm to the body. In fact, you're giving the radiation off of your body to the camera. So it's completely non-invasive. But what we like to have women do is to have a baseline. And that is creating a thermal picture, not like a camera picture, that you would have on your cell phone, but one that's heat. So
hot spots are red, yellow. I'm trying to remember now.
Could be, but we try to look more like at the black and white images. But yes, a blatant something is going on in there could show up definitely as a heat. So we look at metabolic activity. We look at physiology and function of the breast. And those things can precede a cancer diagnosis or a finding of a lump like on a mammogram by 8 to 10 years. So
and that's because why?
Because it takes a long time to form a cancer. And we don't really think that, right? I think we've been programmed to be looking for, early screening is the best detection, but we could do better. We could find cancers or something going on in the breast 7 to 10 years before that, about 8 to 10, somewhere around there. But because cancer cells started out as dividing out at 250. Right. And then they were, cancer cells are highly metabolic. They increased to 500, 700. By the time it's seen on a mammogram, we've looked at 32 tumor doublings and about 4 billion cells, about the size of a blueberry, if you can imagine. So it takes a long time, right, to develop into that.
So it's a blueberry size by the time
it's detectable with regular screening on a mammogram or an ultrasound. So, kind of in short, breast thermography is a test of physiology. We look at function and risk. We can see these highly metabolic cells and we can alert women that something is not right. If we're utilizing, and we do need to utilize breast ultrasound, mammo in conjunction with it too, because we want to make sure to rule out, right, the fact that there could be something present. And if it's not, then we've got a little work to do with diet and lifestyle to fight back something that could be a future cancer diagnosis. So thermography adds the arm of prevention and warning, and using anatomical, which is a test of anatomy, looking for lesions, lumps or bumps, masses of cells. Those are ultrasound, breast MRI, and mammography. So that's cancer that's already here.
Right.
And then once you find that, then you're off to treatment. It's here already. But with thermography added onto that, we have the ability to warn women that something is changing and they can fight it back. And we see it all the time. Women restoring health back to their breasts by doing all the things, right? Watching their diets, lifestyle. We can talk about some of those things a little bit later, but added together, it's an absolute powerhouse. Thermography offers the ability to prevent breast cancer once we've added that onto a women's breast health care.
Right. So we're not just screening, we're working to prevent. And so you said it can find them because of the metabolic activity. The cells are dividing a lot quicker.
Yes.
And then increased blood flow, right? Cancer tends to draw new blood flow to the area. So you see increased vascularity.
Oh,
as
exactly.
Well, which would light up.
Right. So we like women to kind of track their breast health to come in every single year, because now if every single year is like, 4 tumor doubling times, and we can see these changes happening very quickly. And so we like them to come in and get a baseline. And then from that, we're tracking where all their blood vessels are. Everybody has a unique thermal picture. You're not comparing yourself against a bell curve like they do in the hospitals with blood work and things like that. You are comparing yourself against yourself. So when we are mapping out where all of your vascularity is, we can see what belongs to you. We all have our own unique thermal picture.
It's like, I should have mine up here for it. That'd be really
Yes.
Here is Lars.
Well, and even
bigger vein on my right side.
Exactly.
Probably artery coming down on my left or right side than my left.
Yeah. And then we know, hey, that's what we've seen that on Laura all the time. But in spots where your breast might be healthier, where in the future, like say now that you're 50 years old, we can see these different things coming in. We can see blood vessels coming in to create a brand new blood supply to feed a tumor. Without Dr. William Lee has a beautiful podcast that talks about, can we eat to starve cancer? And his whole basis is talking about angiogenesis, which is blood supply to feed a tumor, which can come in, and we can also fight it back, and it can recede with the amount of the right foods. So we're tracking that, right? We can see that coming into an area as this metabolic function, the dividing cells are creating a heat, and then eventually we start to see a new blood supply, which we're tracking via thermal imaging. So coming in on a regular basis, we're able to see that happening, and we're also able to see it going away, which is amazing.
And changes. So if you're and doesn't cover it at this point.
Not
it
typically.
Might in, I don't know how many years. It takes insurance a long time to catch up.
It does.
On everything. So how much is it out of pocket?
So it's $240, very affordable, right? And you can use your HSA. I think you can also use your FSA. But the women that come and see me, they think it's very affordable. That's the whole price.
You think of what's lost. Like, how is that? It's so important.
Well, and I think nowadays we know somebody, right? Our mother, our friend, someone in our church who has had a breast cancer diagnosis, and we know how that affects the family and the kids. And sadly, breast cancer diagnosis happens a lot when we're in our most productive years. We're caring for kids, and it's devastating. So what would we give to be able to know ahead of time and to be able to make changes and ward that off? I think that's empowering.
Right.
Yeah.
So your first one, and then it depends on whether you get it 6 months later or a year later, right? Because I did my first one in October, and had very good results, right?
Yeah.
In terms of, and so should I be doing one in 6 months?
So we'd like to see you come back in 6 months because we're in real time and we're looking at you today.
Yes, I'm due. Okay.
We're looking at you
I just
today.
did the ultrasound, and we'll get to that.
Oh my gosh, time flies. So we would see you back in 6 months because we want to make sure you're trending, right?
Right.
That the trend is for stability, that's staying the same. And so early detection is always the best. So we prefer not to wait a year. Okay. And then after that, if it's kind of staying the same, in a perfect world, we'd love to track you even 6 months later. But because it's
dental cleanings we go, they cost almost that much.
Very
money,
true. I never thought about that. Yeah. So in a perfect world, we would like to have you come back. But if it's staying the same, then I follow our reading doctor's recommendations, which would be yearly. If we see a little bit high risk thermogram, then we'd like to see you back in 3 months. Well, normal tumor can double in size in 3 months. So that's the reason for that. Then we would see these physiological changes, and we can see what's trending, right? Breast cancer is kind of funny. I was just listening to Dr. Jen Simmons, who was talking about the fact that some breast cancers grow at a normal pace, and some, they can even go dormant for a while and have low thermal signatures, which is why we always recommend that we utilize more than one test. Even mammography uses their tools, what we call adjunctively together, right? When they have to call you back and take another second look with a different angle, or they'll add on a breast ultrasound because they want to take another look to characterize what they might see a little bit better. So
what goes along with, thermography, mammography? Let's talk a little bit like ultrasound, breast ultrasound, what that does.
Yeah.
And then there's like a screening side of it versus a diagnostic side of it.
So diagnostic is when you're looking for a problem. So they're going to look more at a targeted area.
And that's if they've already seen something on a mammogram.
And they need to take another closer look-see, which doesn't mean that they're going to... Screening is more what we've been told, come in for your screening annual mammogram. And that's every year just to kind of look. And then that's bilateral. So probably for the sake of our talk, we might be talking more about screening tests as opposed to diagnostic, because we just have to, when we need to look harder, and we need to utilize all of the tools that are available to us, right?
What's it used? Kind of the
screening. So they're going to look completely different. A thermogram is going to be a black and white image based on heat. So you really cannot compare the two.
Thermography, we're going to see.
Thermography is a test of physiology. So if we see an active cancer or we see something's not right, we're going to see it looks different from the other side. Then we need to probably, if a woman hasn't had an anatomical screening in a long time or on a regular basis, then we would suggest to go to that, because we want to rule out the fact that maybe that hot spot, we see a hot spot, we cannot measure a lesion. So ultrasound, MRI, mammography are tests of anatomy. They can do measurements. Mammograms will look for a mass. Ultrasound can characterize a little bit better what that would be. If it's something that is benign, it would have certain characteristics versus a malignancy. They can see a blood flow that's coming in. MRI uses, it's a little bit more sensitive, but they also use the gadolinium dye.
MRI, but that would be a very expensive.
It's very expensive. It's hard to get, right? Yeah, there's definitely a reason why. And it's probably, like I would say, the next third in line. There's also other beautiful imaging that's come out too recently, that not necessarily in the state of Alaska, but there's QT scans, which use a water type of imaging that is kind of MRI, but we're kind of excited about that technology. Only 2 places in the lower 48.
Okay.
So anyway,
so we'll see when I
but they're coming along.
Okay. Very cool. What else do you think is important? Self-breast exams? Should we be doing that? Physician exam?
Very definitely. So I listened to a podcast about a week ago, and it was back to Dr. Jen Simmons, and she was saying that there are doctors that are recommending you don't need to do your self-breast exams, but she disagrees. I do too. Couple of things to be careful about self-breast exams is that we need to do them. Don't do them all the time. Otherwise, you're not going to get a real idea of what changes are taking place in the breast, right? So kind of plan the same particular time. She suggests to do that 8 days after your cycle if you
yeah, that makes sense.
Yeah,
breast can really change with the menstrual cycle.
Absolutely. And to do that at a regular time. I have on my calendar when I have to change my contact lenses, right?
Yeah.
And so just getting into a regular habit, because then you can see when the changes are taking place if you do them about once a month. It's different types of styles, doing that regularly in the shower, laying down. There's a lot more information about that online or through your regular doctor of what might be the most effective for you based on your size and size of your breasts.
And they check them annually with like women's annual exams.
Yeah.
I feel like my doctor didn't last time, but
I
thought they should. Okay.
Yes.
Very interesting.
So I think they're important.
Yes. Let's talk a little bit about estrogen dominance, because I think this plays a role. We were just talking about, your breasts change with your menstrual cycle. Ideally, your breasts aren't getting like really hard, firm, lumpy during your menstrual cycle. That's a sign of estrogen dominance. So what is estrogen dominance?
Could be.
And how do we see that on a
So estrogen is something we want to keep in balance. And too much estrogen, we say a lifetime exposure of estrogen could increase your breast cancer risk. And the reason for that is because most cancers are estrogen driven. So that's like the fuel, right? Just like pressing the gasoline on the pump and accelerating. So this is why we see that whenever somebody might have a breast cancer diagnosis, that they put you directly on estrogen blockers because they don't want to feed that cancer. For balancing hormones, estrogen's important, right? It's skin, it's important for our brains, but too much of that is important to keep that more into balance for that breast cancer risk. It can affect your thermogram. I love thermography, and it's little known that you can see that on a thermogram.
And what is it you're seeing?
So we're seeing kind of it's kind of a spidery kind of all throughout here. And the doctor will make a note of it. And oftentimes soy and flaxseed can be offenders for some women. When you talk to many of the breast cancer specialists, they will tout too that is an amazing thing for your health as well. And so I'm not sure where I necessarily stand on that, but I can tell you that if it is an offender, we will see it on your thermogram for sure. And so it's also important to kind of note, because we need that estrogen, but it could be a progesterone deficiency, right? Just balancing that out. And so the progesterone can kind of quiet that down and give that a balance. So in regards to like thermography, I think it's really a fantastic tool for doctors to use if they're working with women who are adjusting their hormones, or they're on some side of hormone, what do you want to call it? As we get older, we tend to lose them. So we need to be on hormonal things to create better balance, right?
Right.
So it's a great test for that, because we can actually see that in a picture. I was asking Dr. Malu one time why when women have to be put on hormones, their doctor will say, well, I'm not going to do that without a mammogram, because a mammogram won't show the hormones. But what it will show is that if there is a cancer there, then we want to make sure we don't do that. Yeah. But I think we could hone that down a little bit better when we're actually seeing a breast thermogram and seeing on the report that there is estrogen dominance. Right. Of course, still keeping up with our structural imaging, right, as always, but we can even dial that down even just a little bit better, I think, adding on thermography.
Yeah. Just speaking back of mammograms, and then maybe like some of the drawbacks. I know we haven't talked yet, but I'd like to ask about dense breast tissue. One of the things is like half of the women have dense breast tissue, and I heard that's usually typical when you're younger to have it. It's not like something's wrong with you to have dense breast tissue.
No, yeah, it's not. And so don't think it's not. It's just kind of like, I'm short, you're taller.
Yeah.
Right? So it just kind of just is. And we can have dense breast tissues all the way into our 70s even. So it typically is with younger women, which is why they haven't recommended mammography until about, now the studies have kind of changed, but they have said age 40.
So it's just dense and you just can't see through it.
They cannot see through it. Right. Yeah. A dense breast shows up white on a dark field on a mammogram. And so does a cancer. And so it could hide behind that. And so they may not see. So you might get a false negative with the mammogram. Oh, you're good. We'll see you next year, because they weren't able to see it through mammography screening. Now, if you add on a thermogram, now you've added another layer, right? So if there's some metabolic function or activity to those cells, if they're dividing, we would say, are you sure about that? Right. Because we're seeing a little heat signature there, to another area, which would require another form of imaging to try to find what might be there. For some reason, breast tissue is a higher risk of radiation. They tend to react a little bit more to the radiation of mammography as well. So getting back into some of the studies, right? So the radiation exposure can definitely affect.
Do you know how much radiation exposure it is? I mean, it's like, right, a chest x-ray is the same as flying probably from, Alaska to most of the lower 48.
Right.
Same as like one plane flight. It's radiation, but also we're willingly exposing ourselves to radiation. So I love to fly, but I'm cautious of x-rays and unnecessary x-rays.
Oh, absolutely.
Does that make complete sense?
I don't know. I've seen studies about the airplane. I think they've been trying to do them about how much radiation you get when you're flying, but of course that's there, right? But they talk a lot about, a mammogram isn't very much radiation exposure, as much as going through a full scanner.
Right.
But the thing that we don't realize is that when we're going through the airport scanner, we're disseminating that radiation from the field of our whole body. When we're going through a mammogram, it is in this very compressed 6-inch area in a cone. And so this area is getting the radiation.
That's been one of my concerns, right? I'm only 41, so I'm like just on the, start of that. And I'm like, not x-raying them, but more than x-raying. That's more than an x-ray in terms of radiation.
Yes.
Yeah. It seems like a lot of radiation for my chest every single year when we're trying to prevent cancer.
Cancer. And that's part of it too, right? So they say that Dr. Mercola had written that one mammogram equals, I forgot it was, but it was a massive amount, a very huge amount of chest x-rays. And
so many flights.
That every time we go through, have a mammogram, there's a 1% increase in the risk of breast cancer from the radiation that we're using in the mammogram. So if a woman screens from age 40 to 50 with with screening mammography every year, that's a 10% increase. And that doesn't include the callbacks, right? So it could be significant. Going through some of my notes too, there was a study of the fact that in the Journal of European Radiology that they're saying that low dose radiation exposures affect breast cancer risk among high-risk women. So even the more that we're exposed to that ionizing radiation, the more that we're affecting high-risk women.
And there's something too, like the, right, women don't like the super squish that mammograms often do, but it can also do some damage to tissue, right? What exactly is happening?
Well, we're compressing the breast and we're inflaming the breast, right? And so also, we're increasing possibly the risk of ductal carcinoma in situ from that tender smashing of the breast. So what is that? Those are microcalcifications. And so by the trauma to the breast...
And the ducts, are they the same ducts that you use to produce milk if you're breastfeeding? Is that what ducts it's...
Yeah. So in situ means that it's encapsulated in a milk duct. They create these microcalcifications, and that's the overtreatment arm of mammography that we need to be careful of. And I just let women know we need to decide how we want to think about that. Is that something that we want to find? When cancers pick those up, and that has increased exponentially since women have gotten mammograms, ductal carcinoma cases have risen by 30,000%. So once they see that, then they find these microcalcifications, they have to do something about it. And so there's a low risk of that becoming invasive. There's a chance of those just staying inside the milk duct and never doing anything.
Got it.
And then there's another possibility of them just staying there and or the body washing them away. I'm sorry.
Yeah.
The body can just wash them away because our body fights cancer every single day. So when they find them, then women are, they're told to have lumpectomies. Some women decide to take their whole breast off. They're put on extra, treatment, tamoxifen and all of the above. And so I just tell women, if you hear about DCIS or microcalcifications, decide how you feel about it. There are many doctors that say, we don't even want to know about them. And they've been doing studies because change is really hard to come,
yes,
right? And so they've been trying to change the name of of ductal carcinoma in situ to lesions of epithelial origins.
Okay, right.
And take the word cancer out of that.
I was going to say carcinoma.
Because that scares women, right? And so to try to change that name so it's less scary, and they'll call it precancers. And so women tend to, it increases our emotional level, right? Oh my goodness, I don't want that. So I say, get into a book, talk to your doctor, do some research. There are websites that have become very passionate. DCIS 411, ductal carcinoma in situ 411, is a great site to talk about the treatment that they're doing and why do we want to care about it? Do you want to care about it? areyoudence.org talks about dense breast tissue and why we have it, why mammography may not be the test for you. So there's some really good resources out there.
Just by squishing yourself, if you have dense breast tissue, or
no,
it doesn't feel any different.
No,
it looks different.
The only way, apparently, I've been told, is to find out on a mammogram. And so, ladies, if you're getting your mammogram, ask and find out about find it out on the report. They've had to pass laws in some states that the mammogram industry, when you have one, they have to declare what your breast density is on the report. And it's very important, right? Because then you know how effective that test is for you.
Mm-hmm.
So, yeah, the more you know, right?
Yes, absolutely. So how did you get into this?
Oh my gosh, what a journey. And it kind of was just a lot of things happening at the same time in my life, right? So my mom was battling brain cancer and she wanted to cure it naturally. And so to honor and respect her wishes, we didn't know anything about anything, my sisters and I. So I got into a lot of holistic books about how we could fight back cancer and how we can beat cancer naturally. So there's that side of things. I walked into my gynecologist office and I had already had a mammogram years before that and sat in kind of fear with the callback and, oh my goodness, how's that going to be? So went to my gynecologist's office for my yearly examination. Of course, they recommend mammograms. So walked out of the office and my phone rang before I even barely got to my car. And it was an imaging office calling to schedule my mammogram appointment. Now, not knowing anything really much about anything at that point and just doing what the doctors were telling us to do, I kind of was like, wow, you guys are really fast at this. And I felt, I guess maybe having been down that road and then with my mother's journey, I felt like I asked them, are there any other things that we can do? And she told me, you have to have a mammogram first. And those words told me, I don't have to do anything. I don't have to do anything because it's my body and I can wait and I don't have to do what you're telling me to do. And so from there, I kind of started, pondering the thought. And the perfect storm happened. I sat next to a dietitian on the airplane who told me about breast thermography. Okay. She gave my name to her friend who does breast thermography in Seattle. And I flew down to Seattle to have it done because I didn't know of any buddy that did that here in Anchorage. So I grilled this gal just as much as I did that lady on the phone. So she kept asking me, so Sheri, what does early detection mean to you? And finally, these light bulbs came off that it's not just about finding the lesion smaller. Obviously, the smaller we can find the cancer, the better the treatment options are, right? But what if we can find it in its formative stages?
The processes.
Huge light bulb moment when we can see that it's physiologically possibly developing in your body. And we have the chance to fight that back through diet and lifestyle choices, being more proactive with our life. And so that was amazing. That was an amazing light bulb moment. And I went from feeling scared to feeling empowered, right, with my health. And so I kept asking questions, and she had said to me, well, I could bore you to tears with all the information. But no. And I said, unless you want to be me. And I said, I think I do want to be you. And so that started my journey of looking into this. And boy, that was a tough year of researching and trying to find who was the best camera. It led me to even call the FDA and to find out what standards were set aside there, because thermography is FDA approved, but not completely regulated, which is why there are no existing CPT codes for that. And so, anyway, 2015 was the year that I decided to do that, because it really hurt my heart that if women added on thermal imaging, we could make a dent.
This is why I needed you on the podcast.
Oh my goodness.
Because it's so important.
We could make a huge dent in breast cancer statistics, right? Right now they're 1 in 8. They're talking now 1 in 7 is fast approaching. And that's kind of abysmal. They're not changing even despite all of the imaging that we have available. It's not changing.
We're just finding it.
We're just finding it, right? And so I made a call to a reading doctor that we were both interviewing each other. He's with the International Academy of Clinical Thermography. And I told him, I'm Sheri Higbee from Anchorage, Alaska. I'm looking into this. I just cannot believe we can't do this. We could do so much better. Having watched my family, 3 out of 6 of my family members have cancer now. My sister just passed away about 2 months ago from breast cancer. And I said, I just feel like we could just make a difference. And so his answer to me was, that's exactly what I want to hear. So I view my breast thermography practice as more of a mission field to inform women that if we can add on this and if we can start focusing on prevention, now we have something, right? Than just detection.
So let's talk prevention. What can you do? And what stories have you seen where, women were high risk, or you saw, metabolic activity, angiogenesis that increased blood flow to the area, and they were able to do something? What was it? And, what were the results?
Right. So those are questions more, I think, for a practitioner or a dietitian, but there are some pretty no-brainer things. And I'd love to share those with you, just from what we've seen.
Dietitian or practitioner who's actually going to give out these pieces of advice?
Not always.
I would have them on.
Yes, exactly. And it's hard to kind of find the right people. I've got some people that are kind of working in the mix of putting some together prevention things. So, but yes, those are the kind of people that we want to see. We need to kind of start changing the paradigm of what we do to treat breast cancer to what we do to decrease our risk of getting breast cancer, right? So some pretty no-brainer things, right? We need to watch our bras.
That was the first thing I was saying, underwire bras.
Absolutely.
That lymphatic drainage, so that area, the waste products.
Yes.
Clear out We don't want to be tight and constricted.
Totally. We need that blood flow that's going on, right? And so most breast cancers occur on the outer quadrants of the breast. And why is that? Because we are using aluminum deodorants that are stopping our ability to sweat and stagnating all of that the toxics underneath our breasts. Now we've exacerbated that by an underwire bra that's just keeping that there, right? So there was a gentleman by the name of Chuck Messenger who wrote a book, Is Your Bra Killing You? And so I would always suggest, ditch the underwire. I've been to a couple of cancer weekends where they've even talked about the fact that that underwire could be emitting electromagnetic frequencies and attracting that directly to your breast. Yes. So it makes sense, right? So if you like your underwire bra, you can go in with a little needle, pull out that underwire, right? Yeah. So many options. Yeah, so many options. The other thing is that we get in a hurry. We're carrying our kids, we're going to the grocery store, and we're sticking our phone in our bra.
Right.
And that is putting electromagnetic frequencies directly to the breast. And they've even seen a weekend seminar that I attended, breast cancer shaped in the exact shape of their phone. So we have to be very mindful of that. When I'm home, I don't even wear my bra. And back when I was a teenager, I think somebody had told me at one point, well, keep your bra because that's what's going to keep your breasts perky.
Right.
But I think that our bodies inherently know when they need to support.
Yes.
Right. And so they create that support. And so if we're depending on our bra to give that support, we're not letting our body provide that support.
And I don't know if there's any evidence that cultures that don't wear bras have droopier or saggier.
Yeah.
I don't think there is.
I'm not, yeah.
This is one of those things that
it's just one of those things,
it's Cooper's ligament that holds it tight, and it loosens with age. It loosens when you're breastfeeding.
Mm-hmm.
And then we know skin elasticity decreases as well.
So, exactly.
Yeah, it's not because you're not wearing
There's not many podcasts that you get that you have to talk about bras, right?
Yes. Not enough of that.
This is for the ladies. So Dr. Ben Johnson in his book will also talk about, like, at the end of a day, especially particularly for women that are working, we're in our heels, we're going to need to rest our feet. Also take some time to what I would call fluff your breasts, right? And just get that lymphatic fluid broken up. He suggests to do it certain times of the day so that we always, are doing that. So there's that. Proper supplementation is hugely important. There are certain nutrients that the breasts just love.
And what are those?
Well, my doctor had mentioned vitamin D because that can fight 15 different types of cancers. The breast and prostate depend hugely on iodine. So make sure to check with your doctors on what those levels are. But Dr. Brownstein, if you follow him, he's written books about how iodine supplementation can also decrease fibrocystic breasts. So fibrocystic breasts are those lumps that we feel that scare us, another reason to get scared, that send us back in for imaging, that can even bring to another test.
And those tend to be more cyclical, right? Your cycle. Because I got them in my 20s, and that's when I learned, don't wear this type of bra, and it all went away.
Yeah.
When I started paying attention.
Supplementation, all the things are helpful. We have seen women lower their risk of breast cancer just by walking half an hour a day. So even small changes.
That's right. Blood flow to the area.
Exactly. Exercise, right? It's very positive for your mind to get out and clear your mind, which leads me to stress.
Yeah, I was going to say stress.
Stress.
What do you know?
Right. And so one of the books, Dr. Veronique Desaulnay, who I follow, had a breast cancer diagnosis and was doing all the things. She said, I ate organically. I exercised. She's a chiropractor. I did all the right things, right? Yeah. She knows. But when she looked to her life, she found that she had huge, high amounts of stress.
Yes.
And
that's me. I do all the things except for, my stress.
Managing stress, right? And so they say stress is a killer. And it definitely very much can be. So get outside and walk and manage your stress when you start to feel that I get heart palpitations when I have stress. And so that tells me I need to go downstairs and get on my rebounder, which is another excellent tool, right? You don't have to jump high. Keep it in your office and when you have moments, just rock out to a 5-minute song, clear your mind. But that is one of the best exercises for getting that our lymphatic system takes the trash out. And so if we're getting that moving by those gentle bounces, we are detoxifying our body.
Opening one in our lobby now.
Would be so awesome.
Like I should have one of those right in the lobby. Okay.
And they're really fun. And you don't have to bounce really high, just a little, keep it on when you're watching TV and just do some gentle bounces. Can you imagine 2 hours of just a little gentle bounce while you're watching your favorite movie? It can be done. Limit your exposure to electromagnetic frequencies. I think that's just positively huge because that affects our cells. And turn off the Wi-Fi. Put your phone in airplane mode at night. Turn off the Wi-Fi. Just be mindful of that, right?
Right. As everything in our house adds more and more Bluetooth and Wi-Fi, it's insane. Yeah.
It's crazy. And it's getting worse. And the 5G towers, they're everywhere, right? And soon we might be even going to 6G, which is huge. They haven't even, I don't think they've done the proper studies on the effects of the body, but they're quite major. So I think also maintaining a positive attitude about life is really important because it sends a message to your cells, right, to restore health. And the power of the brain is hugely important. Make sure to surround your life with positive people. You can't underestimate the amount.
I was going to say, like, community and belonging in a community is like the biggest predictor of longevity. So it's probably, the one thing that's also going to help prevent breast cancer more than diet. It's like, community is the most important. That's pretty cool, but also something we need to like pay attention to and work actively on as we like go into this crazy digital age. Like, your friends on Facebook are not preventing cancer, but the friends you're with in person, those are.
Absolutely, right? That community for sure. And laughing, laughing together and no, I completely agree with that. We didn't talk about this yet, but we really need to look at our toxic exposure all around us, right? So we talked about the aluminum deodorants. Right. Our cleaning supplies are full of, you can even smell it if you open up a can of Ajax and you're cleaning your bathtub.
And they're endocrine disruptors, right? They affect our hormones.
Right. And so cleaning up our cosmetics, the things that we put on our skin on a daily basis. Think about the fact of these things are being used daily, and that is accumulative. So we need to make better choices in that. Try to substitute maybe using more coconut oil and more natural things on our skin than some of the cosmetics. Be mindful about the cosmetics we use. Vinegar and lemon.
Baking soda for everything.
Yes.
Like, will this wash all my clothes? I hope so.
I buy those huge amounts of baking soda at Costco. And vinegar as well, because I use that to also clean my fruit and vegetable that are sprayed with pesticides, to always make sure that eat organic, buy organic if you can afford to. If not, then thoroughly wash the fruits and vegetables that we eat.
They put some fun stuff on wax too, right? They wax them and then,
Oh, yeah.
So they can even wax the organic ones.
They
can put wax on.
They might, right? And also, I mean, when you really dig into, there's a new product called Appeal that sprays the vegetables to make them look fresher. And so those are nice, full of fun things too. So
stuff that makes our meat look red. And I'm not trying to scare everyone.
No.
The food out there might be.
The goal is to empower women, right? And the more you know, the better steps that we could take. So lots of things to think about. I love my dry skin brush. So it is a dry skin brush with kind of gentle bristles that are also good for the lymphatic flow. But I love it because at the end of a day or after a really dry airplane ride, it just gets everything kind of moving. Some of the doctors that are real passionate about it says that is one of the best baths that you could take is dry skin brushing.
I've heard it's super good for the lymphatics.
Yes. It's just also very therapeutic too. Work on detoxifying the body. Anybody who's been diagnosed with cancer, that's one of the first things that they should really do, because if our body has toxic load, now our body has to fight off a new invader, cancer, and also has to fight what's already in our bodies, right? So if we can detoxify the liver, then our body can fight off disease better. And that also fits in the realm of prevention too. Anyway, so some of the no-brainers of things that we could do. Oh my goodness. Well, back to thermography and just being very passionate about adding that on so that we can know. If you look at my brochure, it says stop wondering and start knowing. So if we know what's in there, then we can definitely be alerted to doing all the things to make our body perform better, avoid a future breast cancer risk. And we see that all the time in the office. I've been just highly amazed at some of the women that have come in and done all the things and watching them lower their risk of breast cancer, moving away, restoring their health. We're seeing these darker, cooler colors being restored. The temperatures are lowering. The need to add on and do more than one form of imaging. I had a lady who was just starting her breast cancer screening career. She was age 40.
Okay.
So this needs to be on my radar now.
Right.
And so she came in. She wanted to do a breast ultrasound and did a full screening breast ultrasound,
Right.
and it came back beautiful, lowest risk possible. She added on her thermal imaging and was at the highest risk.
Oh, interesting. Okay.
And so what does that tell us? Well, that tells cancers, because she had a negative ultrasound, cancer cannot be found, right? An active, a lesion cannot be found. But physiologically, her body is, something's happening, something is changing, and she could be on a trajectory towards developing breast cancer in the future 5 years, prognostically, as a prognostic indicator. So now it's brought into her awareness, wow, this is going on. And if women only did one form, either mammogram or ultrasound or MRI, they're just waiting for cancer to get here. They're waiting to find out and then doing something about it. But adding on thermal imaging, now this lady's empowered to start working towards reversing that pathology. And that's amazing. So many cases of that. That's probably my biggest why. When I see cases like that of women who this could potentially save their life and save their breasts.
So how do people find you if they're in the Anchorage area? Because I think you're the only one in Anchorage.
I think so.
Doing it out in the valley.
Yes, I have a little office inside Balanced Health Chiropractic. It's 6831 Jewel Lake Road. I can also travel to different clinics, scan their clients and patients there as well. It's about advanced thermal imaging, of Alaska. You can look it up I'm online. Yes, you are. And call me. Questions are always welcome. So I really welcome women who are pondering this after their podcast, who want to find out more information, because when I very first started out, had a lot of questions as well, right? It's changing the way that we think. Instead of getting okay, you're good, we'll see you next year. Like with our anatomical screening, now we're in the process of being involved in our health, finding out, am I kind of good? And this is that stability staying well, right? We're not developing or getting hotter. We can even see women improving. So so there's that aspect of things.
Very cool. Where do people find, if they're not in here, if they're listening from elsewhere, just Google breast thermography and...
Yeah, our website is breastthermography.com, and that's my reading doctor. So you can find a center. And he reads for nation and even worldwide. Okay. So if you want to find a reputable center, that would be a really good place to start. Yeah.
That's what I was looking for. Awesome.
Yeah.
Thank you so much.
Thanks for having me. It's been a pleasure.
Thanks for listening to On the Ascent Health. If you enjoyed today's episode, make sure to subscribe so you don't miss what's coming next. And if you found it helpful, share it with a friend and leave us a review. It helps more people discover the show. The views and opinions shared by guests on this podcast do not necessarily reflect my own or that of Ascent Health and Performance. The information provided is for educational purposes only and should not be taken as medical advice.